Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve.
And I'm Scott.
And together we are Backyard Musings, the science and technology messengers. We're not the experts.
Right. And this is definitely a health topic. And that's about all I'm going to say about it right now. So here we go.
Okay. Tadalafil, commonly known as Cialis, a medication widely known for treating erectile dysfunction, is also prescribed for urinary urgency and frequency associated with an enlarged prostate. A large comparative study published online in the British Journal of Ophthalmology on August 4th, 2026, has found that men receiving the drug for these symptoms had a higher likelihood of developing glaucoma, a serious eye condition that can damage vision. Would you like to know more?
The researchers say the findings support careful eye monitoring for patients who take Cialis. I'm not going to try and pronounce that. What is that? Tadalafil?
Yeah, it
Tadalafil.
sounds like a burrito that you eat or something like that. A
Yeah.
Greek burrito.
Yeah. Long term for this purpose, particularly those who already have glaucoma risk factors, including a family history of the disease or elevated pressure inside the eye, which is termed ocular hypertension.
Yeah, I think they check for that when they blow that puff of air into your eye.
Yeah.
All right.
I love
Tadalafil.
that test, by the way. I love it. That's the reason I go to have my eyes checked.
Do you love it more than the drops they put in to enlarge your iris?
I haven't had to have my eyes dilated lately, not to get off on a tangent, but they do something different with me.
Oh,
She uses a really bright light.
oh,
Not exactly sure why it does that, but she says it's as good as, maybe not quite as good as dilation, but I've been had really good experience when the old dilation drops go in. So, but anyway,
all right. Tadalafil belongs to a group of medications called phosphodiesterase type 5 inhibitors, PDE5I, which also includes sildenafil, Viagra. Previous research has associated these drugs with several eye conditions involving structures such as the optic nerve and the macula, the part of the retina responsible for sharp, detailed vision.
evidence specifically connecting PDE5I drugs with glaucoma, however, has remained inconsistent and inconclusive. The uncertainty is especially relevant for tadalafil, which or when it is prescribed for lower urinary tract symptoms, because treatment commonly involves taking the medication every day over long periods.
Hmm. To investigate that possible connection, researchers examined whether tadalafil, a long-acting PDE5I, was associated with an increased risk of glaucoma when used to manage urinary symptoms caused by an enlarged prostate, benign prostatic hyperplasia.
They analyzed anonymized records from 73,854 men aged 40 or older in the TriNetX Analytics Network, which is the global collaborative network. Half had received tadalafil or another PDE5I for their urinary symptoms for periods of up to 5 years. Wow, that's a long test. Between January 2012 and December 2022, while the other half had not been prescribed these medications. So they get nothing?
I guess. A placebo.
Placebo?
Yeah.
Okay.
The researchers compared the two groups over 5 years, examining the likelihood of developing glaucoma, ocular hypertension, or beginning treatment of glaucoma. To make the groups more comparable, the men were matched according to factors that could potentially influence the results. These included age, ethnicity, smoking, alcohol-related disorders, cardiovascular disease. Well, you'd think there's only one disorder, that's alcoholism. Cardiovascular disease, diabetes, cancer, high cholesterol, kidney function, obesity, chronic obstructive pulmonary disease, COPD, and prescribed medications.
I mean, what's left? Death?
Yeah, that's everything.
Yeah. Holy cow. The analysis found that men prescribed tadalafil were 22% more likely to develop glaucoma than those who had not received the drug. They were also 32% more likely to develop ocular hypertension, 33% more likely to develop primary open angle glaucoma, the most common form of the disease, and 33% more likely to begin glaucoma treatment.
You know, Scott, if we just got an AI program, we could scan 70, 80, 90,000, 100,000 records anonymized, and we could come up with some findings. You know what I'm saying?
Sure.
We could get published.
Right. Well, I guess the downside is they were going blind, but they were still having fun. So
Additional analysis found that the associations remained among patients who developed glaucoma within 1, 3, or 6 months after beginning Tadalafil treatment. Similar patterns were consistently seen among patients aged 50 and older, white patients, and people with various underlying health conditions included in the analysis.
Okay. Because the research was observational, it cannot demonstrate that Tadalafil itself caused the increased eye risks. The researchers also identified several limitations, including their inability to account for changes in medication prescriptions and actual drug use over time for the new underlying health conditions that developed during this study period. And that was a long period, 5 years. That's a long test, right?
Mm-hmm.
Yeah.
Most participants were white, which also limits how confidently the findings can be applied to men from other ethnic backgrounds. Nevertheless, the authors write, quote, "These findings suggest that chronic PDE5I may influence ocular physiology, warranting further mechanistic investigation."
But they emphasize, quote, "These findings do not contraindicate. Contraindicate. Okay. Tadalafil. What is that? I know what contraindicate.
It's like to go against
an indication.
Yeah.
Okay. Tadalafil use, but highlight the importance of baseline ophthalmic assessment and regular follow-up, particularly in patients with pre-existing glaucoma, ocular hypertension, a family history of glaucoma, high myopia, which is a short-sightedness, or those requiring long-term therapy." Unquote. Okay. I don't know. Just because of the glaucoma thing, I would stop my use of it.
Oh, so you do use it?
I do not. I say just because of that, I would stop the use of it.
You would stop. Oh, okay.
Yeah, I would.
Hypothetically speaking.
Hypothetically, yeah. Yeah, that would not be a good trade-off in my opinion. So
yeah.
I mean I take any of those type of things into consideration when I see the side effects. You know, I mean, I don't care. It's just not that big a deal to me to have chronic diarrhea or explosive vomiting or any of that stuff that they say that's
nosebleeds or occasional death.
Yeah, exactly. That would be at the top of the list, I think. Possible death. So, yeah, it's just not. Why would they even let them put that stuff out? Yet we've talked about certain.
How could it pass the FDA approval if it's
the cell test? Yeah, put it out on the market test. When we've talked about other drugs that are not even reached clinical trial yet, and they're getting good results, and those that they're not even giving them a second look yet. You know, yeah. I don't know. I don't understand the process. So, but I'm a simple guy.
You got to grease the wheels, spread some money around.
I guess that's probably what it is. Yep. Got to get big pharma.
Make a donation to somebody's campaign.
Yeah. Novartis or somebody's got to get, some big pharma names got to put their name on it, and then they're in. So, but anyway, good story.
All right, folks. Thanks for joining us. We'll catch you tomorrow.
Take care, everyone. Thanks. We'll see you the next day.